In this video, we will be reviewing the Stanislaus County COVID-19 Case Dashboard. We'll go through each tab, identify what is in the tab, and key takeaways you can find. The first tab is Cases. Here you can find the overall amount of cases currently reported in Stanislaus County, the number of deaths that have currently been reported, as well as the number of presumed recovered and presumed active cases. Presumed recovered cases are those cases who either have been hospitalized and discharged, or cases that develop symptoms and 14 days have passed following symptom onset, or cases that never develop symptoms and 14 days have passed following the specimen collection of their COVID-19 positive test. All other cases that are not presumed recovered are presumed active. Below this, you can also find demographic information such as gender, age group, race and ethnicity, and the number of new cases that are being reported by specimen collection date. In the next tab, we will overview hospitalization. Hospitalization information is reported based on a case interview that is completed by Stanislaus County COVID-19 investigators. For each case, they collect information such as if the patient was hospitalized, if the patient was admitted into the ICU, and if the patient was discharged. Here you can review the number of cases that have been reported to us that are hospitalized, the number of patients that reported to us they were in the ICU, as well as the total number of cases that have been hospitalized based on age. You can also see the cumulative total number of hospitalized cases broken out by age. In the next tab, we overview deaths. These are number of COVID-19 deaths reported to Stanislaus County among Stanislaus County residents. Here you can see the deaths reported by gender, age group, when we reported by the date of death, as well as race and ethnicity. The next tab is hospital. This data doesn't overview patients that were hospitalized, but rather looks at hospital bed availability, ICU bed availability, and ventilator availability as reported by the hospital. These beds are used by residents across multiple counties and does not reflect hospitalizations of Stanislaus County residents, but rather hospital utilization of hospitals within Stanislaus County. The adult ICU bed availability breaks out ICU beds available by adults and neonatal. In the next tab, we overview testing among Stanislaus County residents. This overviews the number of individuals tested, the number of individuals who have tested positive, as well as the number of individuals who have tested negative. Another item on the testing dashboard is the testing positivity rate, which looks at the percent of positive cases among total individuals tested. In the next tab, we overview neighborhoods. Here you can see the number of COVID-19 cases among Stanislaus County residents broken out by zip code. The next tab we will overview is county variance. The county variance tab has multiple measures that tell us how our county is doing within the COVID-19 response. The first item to look at is testing capacity. This tells us, are we testing the amount of residents as recommended by the state monitoring threshold? The state monitoring threshold says we should be testing at least 150 individuals per 100,000 a day, looking at a 7-day average. Based on the threshold here, you can see currently we are testing 163.7 people a day at a 7-day average. So we are above the state monitoring threshold for testing capacity. If you would like to review the definition, you can also click the definition tab next to the testing data tab. The next section to look at on the county variance tab is disease transmission. This section overviews if we have elevated disease transmission within Stanislaus County based on the state monitoring thresholds. There are two ways we can look at this. The first way looks at testing positivity, which, according to the state monitoring threshold, if we are above 8% state of testing positivity, in addition to having more than 25 cases per 100,000 people as part of a 14-day cumulative, we are considered at elevated disease transmission. On the dashboard, you can see the testing positivity for a 7-day average is 10.4%, and our current positive case rate for 14 days is 268.4. Based on these two measures, we have met the definition of elevated disease transmission. These numbers will change and vary based on the testing positivity as well as the positive case rate. The other option to look at for us to be considered at elevated disease transmission is simply by looking at the positive case rate. If we have more than 100 cases per 100,000 residents for a 14-day cumulative total, then we are considered at elevated disease transmission. Here, we are listed as at 268.4 positive cases per 100,000 residents for a 14-day cumulative, which means we meet the elevated disease transmission threshold as set by the state monitoring standard. This number will change based on the number of positive cases reported in the past 14 days. Again, if you would like to see the definition, you can click on the definition tab next to the disease transmission data option 1. The next section in the county variance tab looks at hospitalization of COVID-19 patients. This section overviews the percent change in COVID-19 confirmed patients hospitalized, trying to identify if the number of hospitalizations are increasing more than 10%. So we are not looking at a single day of hospitalizations. We look at a 3-day average of COVID-19 hospitalizations reported. So the percent difference represented here is the percent difference between the 3-day average. The state threshold for this percent change in COVID-19 confirmed patients is 10%. Our percent change in COVID-19 confirmed patients is 6.3% from the previous 3-day average. So this means we are below the 10% threshold. This number will change as hospitalizations increase or decrease. If you would like to see the definition, you can click the definition tab next to the hospitalization data. The fourth section on the county variance tab is hospitalization capacity. This looks at the percent of ICU bed availability as reported by the hospitals. The state threshold is set at 20% for percent of ICU bed availability. Here we are listed as 28.9% ICU bed availability, and so are above the state monitoring threshold. The second area we look at when evaluating hospital capacity is the percent of ventilators available as reported by the hospital. The state threshold is set at 25%. Here we have reported 67.2% ventilator ability, so we are above the state threshold. Hospital capacity ICU bed availability does not break down ICU beds by adult or neonatal. Rather, it looks at the total number of ICU beds available and staffed. The County Variance tab is a good place to see how Stanislaus County is meeting the state monitoring threshold standards. The Stanislaus County COVID-19 Cases Dashboard is constantly changing based on new cases reported, information gathered during investigations conducted, and information reported from our community partners.